Bilang dati pong Health Secretary, ano po ang opinyon at posisyon pong ibinigay ninyo kahapon?
On a personal note kasi, para po sa akin, dalawa po ang kailangan na prerequisites, no? Yung quarantine centers, hindi lamang po sa Metro Manila, kundi sa bawat city and bawat interlocal health zone. And this proposal has been presented noong March 11 sa Kongreso. Madali na po yung gawin kasi andun na yung parameters. Second is the testing centers. Napakahalaga po nung paulit-ulit na pinopose natin na kailangan po talaga ng isang COVID laboratory czar. Yung mga laboratories natin ngayon, while it is true na dumarami sila, fragmented ang response because they're acting individually. Walang namamahala dun sa, lalo na sa government laboratory testing centers, yung ating sub-national laboratories, na meron sila mga konting pangangailangan na kapag hindi agad-agad natutugunan o kung hindi man na-project, this will affect, it is actually affecting their efficiency and we are not maximizing their capability. And again, this will affect the whole gamut of it kasi yung puso ng pagpaplano at guide mata ng ating mga officials, both local and national, ay nakadepende doon sa testing centers.
Ma'am, well, of course, we understand na the President is still to make a decision on what to do after April 30. Pero kahit pa paano po, ilan po kayong mga dating health secretary na nag-attend kahapon, meron ho bang consensus among the former health secretaries as to whether or not to extend the existing lockdown or to modify it?
Among us, Secretary Cabral, myself, of course, kausap din namin si Secretary David. Unfortunately, hindi siya pwede. No? He had other things to attend to. And si Secretary Jimmy Galvestan naman. But basically, yung tatlo kami, we have internal discussions among us. We are one in saying that a modified community quarantine should be in place after April 30.
Modified community quarantine.
Yes.
Ma'am, how do you qualify po modified? Exactly ano po yung parameters?
Ang parameters doon sa mga nagkaroon ng control ng transmission at dun sa mga wala naman talagang active transmission. As long as the quarantine facility is in place, the health system has been assisted. Yung iba kasing nire-require ng DOH, kagaya ng mga ventilators na hindi naman nila pa-comply, sa personal ko po kasing pananaw, mahirap nating pilitin ang isang equipment na may global shortage tayo. However, may second line tayo. The anesthesia machines are actually convertible to ventilators. So, dapat pwede yung pagbigyan ng pansin or pwede yan yung i-allow kasi yan yung available. Mahirap tayong maghintay sa wala. So, we have to widen our horizon in looking for measures na hindi naman natin i-compromise yung quality. Pangalawa, kung titingnan po kasi natin, for me, no, on the health aspect, karamihan po ng sakit, hindi lamang po COVID. So if we will implement, if we will not lift the enhanced community quarantine all over the country, karamihan po ng ating kababayan, yung mga nagda-dialysis, hindi makakapagpatuloy, not on the access, but on the expense. Yung mga isi-cesarean, biglaan supposed to be nagpre-prepare sila ng pera, biglang naputol. Yung mga maintenance medicine, yung ibang diabetic na hindi na makabili ng kanilang insulin, napupunta dun sa mga komplikasyon. Yung may cancer na early naman at nagkikibaw sila at may mga naka-schedule, subalit wala na ng pambayad. Kasi 70% of our health cost is out of pocket. So while we do believe that COVID should be addressed in areas na hindi naman ganon ang transmission as long as the testing center is in place, and I actually enumerated the choke points. Alin po ba yung mga bottleneck? Bakit po ba konti at bakit hindi na ma-maximize? Alin po ba yung areas na isang tawag lang ng presidente sa isang bansa, malaking bagay po ang mai-improve sa atin? And he was very receptive to most of this. Kaya nakikita po natin na yung dun sa mga outside Metro Manila, and of course, especially yung mga manufacturing companies, yung atin po mga drivers, yung ating po mga katulong na arawan, yung naglilinis ng ilang bahay, if they will be tested, and if may nakalay down naman po kasi, we wait for the national government to speak on that. Pero bottom line is, there is a huge fraction of our population who can actually slowly go back to work. At doon naman sa mga probinsya, ang assistance na kailangan, although maganda naman ang special amelioration program, mas maganda pa rin at mas malaking tulong sa kanila if trade will be assisted. Kasi yung produkto nila doon, lalo na yung produkto sa pangingisda at sa agrikultura, kung mabigyan ng tamang presyo at madala dun sa mga demand centers, talagang makakapagtulong, hindi lamang po sa mga negosyante, but we are looking at it on the health aspect.
Opo.
Because we cannot afford to have more deaths due to non-COVID illnesses.
Yes, ma'am. Ma'am, just to be sure that I get it clearly. So kayo pong tatlong mga dating health secretary nagkasundo sa isang modified community quarantine on the assumption na yung mga bayan na hindi naman matindi yung transmission, pwede nang luwagan na kaunti basta lang merong testing center na maayos at merong quarantine facilities na maayos. Paano po yung tama ho ba? Ganun ho ba ang pagkakaintindi ko?
Yes, and pinagdag pa namin dyan yung recommendation on how the testing centers can be maximized at yung mga areas na makakatulong ng malaki yung rapid testing.
Yes, ma'am. Pero
kasi
ito pong
areas na malaki ang transmission, kung titingnan natin ang pag-aaral ng Stanford, lumalabas na 5% dun sa population, apparently, nagkaroon ng infection na hindi nila alam at sila naging protektado.
Ma'am, pero itong pong mga luluwagan, itong mga areas that qualify dahil mababa, dahil may testing center at may good facilities ng quarantine at mababa yung transmission rate nila. Ito po ba'y luluwagan yung mga restrictions dun sa mga commercial establishments, public utilities, mga pabrika, and so on down the line? Ano hong recommendation?
There were categories that were being discussed. And mas maganda po siguro na hintayin na lang natin po yung ating presidente, ating Pangulo, or the executive office to lay down their decision. But yes, isa-isa pong pinagtuunan ng pansin at diniscuss yung specific areas kung saan ba yung magkakaroon ng malaking impact. Again, uulitin ko, no? Our discussion shifted not to providing advantages to this businessman. Kasi akala ng iba, negosyo ang pinag-uusapan. But the discussion shifted to how we deal with public health sa pangkabuhan. Yung bang ina-address natin yung COVID, pero hindi naman natin papayagan na mas marami ang mamatay sa non-COVID illnesses.